Unfortunately, insurance requirements, you go in, you have one set of problems, which may be your physical, but an acute care issue's popped up. You got a sore throat that day, but you can't talk about it because your doctor won't be paid for it if they tried to do your physical and your acute care. That's ridiculous to me. Unfortunately, patients have the perception that it's the doctors that are making the decision, or it's the doctor's fault, when it's not our fault. We are working within the system that we work. So it's not that we want to cut the visit short. We also don't want to get fired, okay? Because our jobs are literally our livelihood. We have families, we have mortgages, we have car payments, we have healthcare insurance to pay for. We don't get free healthcare.
Right.
So all of the things that all of our patients are dealing with, we as humans are dealing with as well.
How can patients be better advocates for their own health, and how can providers support that?
Don't be afraid to ask questions, and don't be afraid to get a second opinion.
Okay.
Because I know I don't know everything, and I'm okay with not knowing everything. And I will be honest with you and tell you, I don't know. I can research and I can ask some colleagues, but I may not know. So don't expect one person to always have the solution. And if you feel in your gut that something may not be right or missing, get a second opinion. Get a second opinion.
So if you could give your younger self one piece of advice, what would it be?
Enjoy the moment now.
Welcome, everyone. I'm Rachel Nash, a board-certified patient advocate, and I'm honored you're joining us for a very special episode of My Patient Advocate. Today, we're joined by an amazing guest, Dr. Crystal Maxwell, the founder and CEO of Light Family Wellness, the first direct primary care practice in Indian Land, South Carolina. Dr. Maxwell has a remarkable story of dedication to community wellness, healthcare innovation, and advocacy. A proud Spelman graduate, a physician with years of experience in family medicine, a leader in ministry, a mom, and a voice for change. Dr. Maxwell has spent her career building systems of care that prioritize the patient first. And I can attest to this. She's also my doctor. Today, we dive into her professional journey, her vision for healthcare, and the values that drive her. Dr. Maxwell, thank you for being here.
Thank you so much for having me. It's a pleasure.
So you have accomplished so much, from starting your own medical practice to being appointed to the South Carolina Mental Health Commission. Can you share a little bit about your journey and what inspired you to pursue medicine?
Absolutely. I've wanted to be a doctor since I was 14 years old. Unfortunate situation that led it, but it inspired me nonetheless. But my grandfather got diagnosed with prostate cancer, and he unfortunately had one of the aggressive types of it. And especially as we talk about Joe Biden being diagnosed, and his is aggressive form, kind of brings back some memories for me. But he had one of the aggressive forms of it, and going in and out of the hospital, seeing doctors, seeing medicine bottles, hearing the medical lingo and not understanding what it was at 14 sparked my interest in science. So after that, I began going to science camps, and I knew I wanted to be a doctor. I was like, I want to know what they mean, why they're doing what they're doing. I want to be able to diagnose and to treat people and to help them feel better. So that sparked. After that, I was like, I'm going to be a doctor, and here I am till my age 30 years later.
Wow. Why did you choose family medicine as your specialty?
I grew up in rural Mississippi, so we didn't have a lot of specialists there. So even the doctors that I saw, like my pediatrician, it was a small town doc. And they did everything. They helped all the families, saw us from little to we left for school. And I felt like I wanted to do that. And even after I actually got into med school and I started my rotations, I did surgery. I wanted to be a surgeon. I did OBGYN. I wanted to be an OBGYN. I did neurology. I did psychiatry. And I was like, yep, I need to be a family doc because I love all of it. And so that continued I want to be a part of the family. I want to be that kind of quarterback of the team. And so family medicine was it for me.
What made you decide to step into the model of primary care and open Light Family Wellness?
So I had been practicing for 10 years at a community health center, and for 8 of those years, I was the chief medical officer. So I had voice in what schedules look like and trying to make it better for both the clinicians who were taking care of people and the patients we were taking care of in terms of time, trying to extend office visits so that we can talk about a lot of the concerns that people were having when we were only having about 10 minutes or so to be able to do so. But unfortunately, because of insurance requirements, grant requirements, a lot of things, we couldn't accommodate the number of patients that we were taking care of with being able to extend the amount of time that we could dedicate to them. And so when I was thinking of, it's time for me to make a transition in medicine, I need to do something else, but I need it to look differently. I need to be able to be more personable with people because I didn't feel like I was doing the dream of what I thought about at 14 and saw myself being part of the family like I did when I was 14. And so I began talking to some other docs who were independent, going to some conferences and hearing about what it looks like to be an independent doc. And I decided to take a chance on me so that I could mold my practice to be the way that I felt that healthcare needed to be delivered.
So can you talk a little bit about direct primary care and when that was established? And
Yeah, direct care has been around for years. I don't exactly remember off the top of my head the year it was founded, but I mean, well over 20 years.
okay.
It kind of, we had a shift in healthcare where physicians went to be employed, and so there weren't a lot of physicians who were doing it anymore. But we're seeing that pendulum swing back in the last 5 years or so, and it's really building up now that physicians are realizing we need to be making the business decisions when it comes to healthcare. Because yes, we can treat and diagnose, but the way that we can treat and diagnose, we need to be more in charge and have more say so in that. So the pendulum is swinging back for physicians going back and taking that ownership, and the direct care membership model allows us to be able to do that because I'm sure you've experienced, unfortunately, insurance requirements. You go in, you have one set of problems, which may be your physical, but an acute care issue's popped up. You got a sore throat that day, but you can't talk about it because your doctor won't be paid for if they try to do your physical and your acute care. That's ridiculous to me. And so being in a model that it doesn't matter what we're talking about today, we can change what we need to, or we can do a combination of things. It makes sense to me because people are people. And we need to be able to treat the person.
Right.
Yeah.
I really feel that, I know we're not at the advocacy part yet, but this is a great solution to patient advocacy because when someone has you, they really don't need a me. You're helping them navigate, and you're treating the whole person. A question that I've always had is with Light Family Wellness, can you tell me what Light represents?
I can. So LIGHT is an acronym, and it means living in God's holy temple.
Okay.
So before I opened my practice, I was doing, and I still do community talks, like going to churches, and if someone asked me to come and speak on a particular talk, that was kind of the theme that I used for my education pieces. So when I decided to open the business, it made sense to me to name the practice after that because He is why I'm serving. And so that's where it came from.
Wow.
Yeah.
I'm glad I asked that because I've always wanted to know.
Yeah, it initially came when I was in junior high, middle, somewhere in between elementary and middle school. It was kind of a group that I had kind of thought of that was you invite somebody to the group and we kind of do a Bible study together.
Okay.
It never really took off. I didn't do a whole lot with it. But it came back to my mind when I began doing my education pieces of inviting people to hear people talk and getting the word out about your special invitation to come to this kind of personal thing that is just for you. And so God gave it back to me way back then, and here we are now.
Wow.
Yeah.
I love that. I wanted to ask you about your grandfather. So, because I know that was when sort of it was born for possibly you to be a doctor. Tell me about what what happened? He was in a very, he had a, can you talk a little bit about your grandfather?
Yeah. It went pretty fast, unfortunately.
Oh.
But he, after being diagnosed with the prostate cancer, just going through his treatments, hearing about the medicines, it was all just very interesting from that standpoint. One of the things that frustrated me was I would hear, I'm kind of an old soul. I like being around the older people when I was young. So I probably heard conversations I wasn't supposed to hear, but I would hear them still not understanding what some of the things meant that the doctors were saying. And they still had a lot of questions of why. And it was like, well, you just went to the profession and you don't understand. But they used a lot of big terms.
Mm-hmm.
And so one of the things I always took with me was I want to make sure I break down what it means in simple terms, in people language, not doctor language, because that medical interpretation can be very scary to people, and you have to find a way to break it down on their level so that it's not as intimidating. So I've taken that with me to try to make sure, how can I make it more approachable for you? What does it make more sense for you? How can I get you to understand it where it's more relatable?
And I have to say that when I know when I get my labs back 3-4 times a year, I'm always a little nervous. And you are very calm and you explain it in a way that it's very clear. And that helps because there are times we just don't know to ask questions. And it really helps. And that's something that I don't think the system has time to do. You get your labs back and you're like, what is this?
Right.
But not with you.
And that is part of why I went into the direct care model, is so that I can have that time to explain those things. And even when you say having someone like me takes no place for you, the system is so complicated, we still need you. Okay.
Oh, thank you.
It's a team. Healthcare is a team. But having that team allows for me to have the time to explain to us. It may seem simple and it may seem like, okay, that's negligible, but to the person who hasn't gone through 11 years of schooling to become a doctor, it's not as simple to them. So I don't get irritated or frustrated when someone is asking me, well, why is my HC high? Well, it's not something serious, but I can understand when you don't know what that means, it's flagged.
Right.
So having the space and the time in my model allows me to decrease the fear and the frustrations that people may have, and decrease some of the doctor Googling that people will do and go down the rabbit hole and think that they are now dying because there was one red flag on there. And that's what people need.
Yeah.
That's what people need.
So another great thing about this model is you have access to an MD.
Yes.
And you said 11 years.
Mm-hmm. Yep.
That's a long time.
It is.
For many people in the traditional model, they are seeing, because it seems that doctors are somewhat being squeezed out, or maybe there's not enough doctors. Individuals are seeing nurse practitioners and PAs in a short amount of time. Now, I understand there's a need. What was the design for a nurse practitioner or PA? Can you talk a little bit about that?
The original design was for them to work in tandem with the physician.
Okay.
So nurse practitioners started out with nursing care, and they went on to do advanced degrees to be able to do practicing. But their original foundation is in nursing care, which is a huge and important part of healthcare. But that nursing care still doesn't take away or doesn't take the place of how physicians are trained when we are trained to diagnose and treat and medications from the start. So nursing coming into practicing is a great thing, and especially the ones who've been practicing a while and they have been in collaboration with really good physicians to learn some of the more advanced techniques, it can work very nicely. But unfortunately right now, for what I've seen, there are some schools that they have gotten nursing education, but the diagnosing and management has not been a significant part.
Right.
And so that's where it gets concerning with some of the nurse practitioners out there. All doctors are not good, honestly, okay, with the same token. But just with the original design, even with physician assistants, they were designed to be a part of the team with physician-led care who have doctorate level training in diagnosing and management.
So not in place of.
And not in place of,
Okay.
but as part of a team.
Okay.
As part of a team.
Can you talk a little bit? I want to hear a little bit about medical school and what that looks like time-wise, and I've always been curious.
So medical school traditionally is 4 years. There are some that have done a little bit fast track where they've gotten it down to like a 3-year where they've done a dual with an undergraduate program so that you get some of your squeeze out your time with doing some of your your classes a little faster, but traditionally it's 4 years. Generally, the first 2 years are your core curriculum where you're getting your foundations of your chemistry, biochemistry, physiology, anatomy, pharmacology, all of those basics. And then the last 2 years you're spent in the hospital actually learning patient care under a team of doctors. You're the lowest on the totem pole because then there's the residents that are in the hospital, and then there's the attendings who have finished all of their training, and they are the real ones in charge. But you have 2 years of having this protected space of being able to learn how to diagnose and treat people. And then after you finish that, you go into your particular specialty that you want to do, and you go and further specialize. And that will be anywhere from 3 to 8+ years, depending on how special, what specialty you're going into. So it is a long journey. But when it comes to understanding the human body and the many things that we know about disease state and management, it takes a while of being in the elements and being around the people who have already been trained to learn how to do it.
So people that go to medical school and they find themselves working in the traditional model, is it burnout? Does that happen soon? What does that look like for doctors today?
There is a definite burnout, which is why, again, we're seeing that pendulum swing towards trying to have more physician ownership and do more direct care type models, because you are being asked sometimes to see 30+ patients a day, plus do your charting, plus do your billing and coding, and that can be rejected for so many different reasons that are frivolous when it comes to taking care of the patient, technicalities. Right. And unfortunately, insurance companies don't always share all of what the rules are for getting paid, and it can become very daunting and frustrating.
Okay.
To undergo that continuous amount of stress and demand, because when you're a physician, you are treating people. And a lot of us take that to heart. It's not just let me go to work and then I go home. Mm-hmm. We are putting our personal selves and how we feel into the people that we're taking care of, and the stories that we hear and the people that we lose. While you may be, having this beautiful well child visit and the child is growing beautifully, you next get a phone call that Miss Susie fell down and broke her hip and she's 85, and you know that 85-year-olds, they generally die in less than 5 years after, having a hip fracture. And then you get the diagnosis of the cancer, but then you come back and you get the strep throat, and you have the kid that says, thank you for taking care of me. We go through all of those many emotions very frequently in taking care of people. So it's a lot of different extremes that we emotionally have to take care of, in addition to we're people. So we're moms, we're wives, and we have families. And so on taking care of people, on top of taking care of people, we are trying to take care of our own homes,
Right.
our own parents. And so trying to balance all of that demand in one emotionally can become very, very taxing.
Right. Wow, that is a lot.
Yeah, because we're human.
Right.
We pretend like we may not be, but we too are humans too. And I think that that's one of the things that get lost.
Right.
When it comes to physicians, we are humans. Unfortunately, it's been a long expectation that, you know, we suck up our sickness because we can't be out. When we're out, you know, and you have 30 patients on the schedule, where are you going to put 30 people that
Right.
day? And you were already booked tomorrow for 30. So there's this, you know, push of, no, you can't take time off, and can you add someone else in because they're sick and they need to be done? And it can become very, very stressful when you don't have the good culture of support.
What is the biggest challenge that you have, and also the rewards of running an independent practice in today's healthcare landscape?
Primarily, probably the biggest thing, first and foremost, is one, still getting people to understand the direct care model and how it still can complement, even though you have insurance, of why you should, you know, consider having a direct care physician. It's very unfortunate that the cost of insurance with what they don't cover makes it limiting for some people to be able to do. Some people can't afford both the premium plus the primary care membership, although still a lot of the things are not covered, even when you do go to one of the doctors who are with, quote unquote, within network and are covered by insurance. But getting people to understand those nuances about what your co-insurance is going to do, what your deductible is going to do, how much are you paying out per year, because you probably will end up saving. In the end, it may not look like it on the front end, but you probably will, because you're still going to be paying out quite a bit when you go and have the visit, when you go and have the labs billed on the back end because you don't know how much it costs.
Right.
So you still getting people to understand that you may not see it at the front, but you really still are going to be paying out a lot more, even if you're not. But you can reduce some of those costs with the direct care. It's probably the biggest frustration that I have right now.
It is. I can see that because, you know, I do have health insurance, but I also am a member with a direct, for, you know, you're my doctor, direct. I have saved money. I have saved money in the pharmacy. I have saved money since you've been my doctor. I have not had one urgent care trip.
Mm-hmm.
And there's always a bill on the back end.
Yes.
There is. You go in, you pay your deductible, not your deductible, you pay your copay, and somehow there's a bill that you're going to get later.
Yes.
And I've stayed out of the ER. I have been sick less, and medication has been less for me because you look at the root cause. You know, I have called you and said, I think I have a sinus infection. And you've said, okay, before we do antibiotics, I want you to try A, B, and C. And I try A, B, and C, and I'm okay. So my immune system is getting stronger, right?
Mm-hmm.
So those things are happening. So the return on investment is good for me. It really is. And it's been good for my patients as well. So you said that before, that community is the heart of everything you do.
Mm-hmm.
I have seen this. I have, you know, I'm part of the same community. How does your practice reflect that value?
So for one, I am on the board for Hope in Lancaster, which is an organization that provides emergency food services and support for those who may find themselves in a bind in emergency situations. And I enjoy being able to support that organization and making sure that the business side of it is being sound for the people that it serves. As I mentioned earlier, education has been a huge part of who I am and what I do. And so I've, you know, continued to do health talks, go out to churches and speak, providing that health education to people. And I've fortunately, as my business has begun to grow, I've been able to be a sponsor for some events. We've had the Indieland Festival recently. I've been a sponsor for the NAMI Walk for mental health, raising funds for that. Our local, one of the Bridge Mill community right behind me has a swim team. And so I'm a sponsor for their summer swim team. So looking at ways of whether it's if I can donate financially or give some education or just support, other local organizations within the community. I've tried to find those different things of, where can I put my energy? Where can I put my space? Because there's so much misinformation that's out there. And I want to try to make sure that I'm putting out videos and giving talks of what's scientifically proven and safe for people. So that's been my charge and what I've just tried to continue to do.
I do love your content, and there was one just I saw, and it was a reminder to wear sunscreen. Because sometimes there's little things, those little things we forget. And I saw that, I'm like, okay. So I really do like what you share. And I also remember you attended my very first, I joined the Lancaster Chamber. And my business, I was brand new, and you came out, and you were very engaging. And we had a moment to speak, and after I realized the importance of direct primary care, it was a no-brainer. And then you're such a caring person and a caring doctor. So it was a no-brainer who I chose. So moving on to leadership, ministry, and mental health. Ooh, mental health. Ooh, lots to unpack, isn't there, with mental health?
Yes.
You serve as the healthcare ministry coordinator at Freedom Temple Ministries. How does faith intersect with your medical work?
It is at the core. And again, that's why I named the practice Light, Living in God's Holy Temple. So that is how I view people, is that your body, you only get one. We've all been entrusted with one. And I want to make sure that when I'm given recommendations, that I'm given safe things that have been shown to be effective in taking care of your temple. Because that's what it is. You are somebody's niece, uncle, loved one, right? And so I want to make sure that I'm doing my due diligence to give the best advice that I can, because that is your temple he trusted you with. And so making sure that I'm making sound medical decisions. I pray for my patients even though they don't know it. I have, people who've gone through things, and we've been in the office together and they needed a moment of prayer. We've prayed right in the room, which is not something that is necessarily open when it comes to being in a traditional business type. You do have to kind of set your religion and things aside when you are working for a big business. So being in my own practice and being able to express my views on a spiritual side and share that with people who are receptive to it, I appreciate having that autonomy to be able to do that.
And I believe, tell me if I'm wrong, that research does suggest that there is power in prayer when it comes to healing.
Yes.
Medical healing.
Yes, it absolutely does. We are mind, body, and soul. We are not just one. And so having that faith in a higher power than you can give you more positive outlook and more peace to be able to go through the things that you go through.
So what has your role on the South Carolina Mental Health Commission taught you about mental health needs in our state?
That was very eye-opening. I was sad to see that the commission ended with they've combined multiple departments to make one big department now. So that has transitioned, but the time that I spent was eye-opening in seeing, one, the vast majority of mental health needs that affect our state, and particularly the remote areas that it's hard to get to a city that might have a psychiatrist, and what the Department of Health did to be able to bring telepsychiatry in so that people who can't travel to a place can have access to a psychiatrist. Is it not ideal to be in the same room? It is, but they weren't going to be in the room, period, because they weren't going to be able to drive there. So being able to see what they were able to do to make telepsychiatry a possibility in our state was huge. One of the unfortunate things also is the pay in South Carolina for mental health clinicians makes it very difficult for us to be able to deliver care effectively. We are not able to retain the people that we need to retain with the quality of clinicians that we need to maintain.
Is that psychiatrists?
Psychiatrists, mental health therapists, our school-based therapists. Because unfortunately for school-based, a lot of the school-based who love working with the kids from a mental health standpoint ended up working for the schools because they got more pay, or an independent person coming in than working for the state, when they were very, very bright. But that changes the role of a school-based therapist from really helping with the mental health aspect to more of a counselor kind of thing. So we've lost a lot of talented clinicians that can be helping to serve people. And I'm hoping that with the transition of it being the new model that is being done for the Department of Mental Health, that will open up some additional dollars to keep the beautiful talent that we have and bring us on par with being able to pay people to stay to provide the much needed care that we need.
Can you talk a little bit about the new model?
So I don't remember all of the ones that combine, but they're multiple, like the drug and alcohol.
Okay.
They're all combined into one with Department of Mental Health, so that now it goes into the cabinet of the governor as opposed to being an independent department.
Okay. Where do you think we need the most help? But you did say we need more clinicians.
We need more clinicians. We absolutely need more clinicians, which we need more funding to be able to do. So more of our federal dollars, state dollars, being able to be directed to be able to support the mental health efforts, having more of the telepsychiatry being able to be available, more mobile units that some counties have been able to have to be accessible and to reach people. We need more of all of that. We need more of all of that.
Yeah. Do you see differences because I know you work North Carolina and South Carolina, you have patients. Do you see differences in the two states, or mental health is?
It's pretty similar.
Okay.
It's pretty similar.
Okay.
Yeah.
It's very difficult right now to find, I think it's in North Carolina, I think it's about 10 months to find a psychiatrist.
Yes, if not longer.
If not longer.
If not longer. And then unfortunately, you hit while there may be an availability access issue in terms of when can they get you in, the other big issue that I have had has been they are not in network with the person's insurance.
Yeah.
And then because I am on the border with North and South Carolina, if you're a South Carolina patient with certain insurance, even though the North Carolina facility may be closest to you, it may not be in network. And so then you're having to travel further in South Carolina to get care when someone is maybe 15 minutes from you,
Right.
because it's a different state. So those nuances can make it very, very difficult.
So we're moving on to advocacy, access, and what's next. What do you believe is most misunderstood about the healthcare system from a patient's point of view?
Unfortunately, patients have the perception that it's the doctors that are making the decisions, or it's the doctor's fault, when it's not our fault. We are working within the system that we work.
Mm-hmm.
And doctors get disciplined and when they don't abide by certain guidelines. There are some systems that if you are in a patient room longer than the allotted time, you get in trouble for that. So it's not that we want to cut the visit short. we also don't want to get fired, okay? Because our jobs are literally our livelihood. We are, we have families, we have mortgages, we have car payments, we have healthcare insurance to pay for. We don't get free healthcare,
Right.
okay? So all of the things that all of our patients are dealing with, we as humans are dealing with as well. But when it comes to that, it is our job in a business model. Some of those decisions that we have to make are not ours. And we are trying to do the best we can to balance what we do want to do for you as a patient and what we feel that you need versus making sure that we are doing it within the system guidelines that we've been provided.
That is very, Dr. Maxwell, that's very important. I remember when I started, I was very curious. Why 10 minutes? Why? And then I did realize that I can't be a fierce advocate for patients if I'm not a fierce advocate for doctors, because I saw who had, I guess, the control. And unfortunately, it wasn't the doctors, the ones that went to medical school for all those years that we need and we want.
Yeah.
So I love this next question, because if you could wave a magic wand and fix one issue in our healthcare system, what would it be?
That doctors are making the final decision of care. Because unfortunately that is not in our hands. Even when it comes to from what medications we're recommending to what procedures we may or may not do. Insurance companies have the final say. If it's not covered, we have to switch to what's on formulary. Or if we think that an imaging may not be done and we have to do a prior authorization, they can deny it, and they have denied it. And then you have to go back and try to appeal, which is more dollars, more time wasted. So I wish that doctors who trained to all of those years that we went to school could actually practice medicine the way that we were trained to do.
Do you feel we'll get back? Do you feel we'll get back there? I know that one's a loaded question, and I'm sorry to ask it, but
Yeah.
It's just me wanting it.
I wish I could say yes, but I don't have much hope.
Okay,
I think it may get better.
I understand.
But in the foreseeable future, our hands are tied.
And I sometimes think it's going to be a grassroots effort. We as people have power that we don't know we have. How can patients be better advocates for their own health? And how can providers support that?
Don't be afraid to ask questions, and don't be afraid to get a second opinion.
Okay.
Because I know I don't know everything, and I'm okay with not knowing everything. And I will be honest with you and tell you, I don't know. I can research and I can ask some colleagues, but I may not know. And so don't expect one person to always have the solution. And if you feel in your gut that something may not be right or missing, get a second opinion. Get a second opinion. When I went through heart failure when I was 30, and I was hospitalized, and we were not given the information that we needed about what was going on with me and why certain medications were being given, and we fired the cardiologist.
Good for you.
You have the power to fire whoever it is, or it may not necessarily need a firing, but just get a second opinion. If you are, continuing to go through the same kind of rat wheel and hearing the same information and you're not sure if there's something else out there, get a second opinion. It is okay to get a second opinion. I can't tell you that enough. It is okay to get a second opinion. Talk to your doctor. Can we just get a second opinion about something else? And if they are not willing and open to hear that, then that may be where it's time to fire them. And as physicians, it's being open to hearing the questions that your patients ask. And it can be hard when you don't have the time and you've got to get to the next patient. But you have to remember that that person in front of you is a person. They are a life. They are a loved one. And we still have to do our due diligence of making sure that we hear their concerns. And if we can't address their concerns, then get them to the place they can.
When you got your second opinion, what was that? What was the difference between the first and the second? Can you talk a little bit about the?
Yeah, so the second person just called on the phone. They didn't come in the hospital, which I understand. It happened on a Sunday. Unfortunately, things that happen on weekends, you're not going to get the full of what you do Monday through Friday.
Okay.
And I understand that, and that is fine. But the second cardiologist actually called on the phone and talked to me and explained what was going on.
Okay.
And after that, you know, that's fine. I talked to someone who can tell me what my diagnosis was and why I was being, giving certain medicines.
Right.
And having that knowledge under just knowing what it is, and I'm not spending the rest of the night wondering what we're doing is huge.
Right.
And not only that, when he told me the diagnosis, I was able to tell him that I had gotten fluids because we thought it was a pulmonary embolism.
Oh.
I was 30, okay? So nobody was really thinking heart failure in a 30-year-old. I was 30 years old, I had a recent flight, and I was on birth control pills. So, we're thinking it may be a blood clot.
Mm-hmm.
So I got in a CT scan with contrast, and they had given me fluids to kind of flush the contrast out of my kidneys, which is pretty standard because contrast can injure the kidneys. So they had given me fluids to flush my kidneys to protect from the contrast, which was fine. But I let him know. I said, well, okay, I have heart failure, which means I know that medically means my heart is not pumping, I'm fluid overloaded. They have not given me Lasix yet. Like, they named medications, but I've not gotten any fluid pill to get the fluid that I already had prior to coming here off with the additional fluids that they've given me for this. And he was like, what? So it makes me cringe sometimes when I think about what could have happened over the course of the night had I not asked for somebody else.
Right.
Would I have ever gotten the fluid pill because it wasn't recognized before? And that is another reason why I do try to make sure I'm educating my patients in a level that they understand. And I like being accessible to my patients. If you're in the hospital, you have questions, just text me. It's okay. I want them to take care of you. I don't do hospital medicine, but I can at least guide you through what are some questions to ask while you're there. And if I need to hop on the call with them, I'm happy to do so if you don't understand what they're doing.
Right.
All of that matters to me.
Yeah.
All of that matters to me.
I've noticed within the hospital systems and the system, maybe you can explain this to me, as years ago, there were specialists that would come to the hospital.
Mm-hmm.
And now the hospitalists are, can you explain a hospitalist for people that don't understand why they are the doctor that somebody would see for whatever issue, whatever diagnosis they have?
Mm-hmm. So hospitalists allow for someone to be there on a scheduled basis.
Okay.
And so that improves your continuity of care, of making sure that you have one person that's taking care of you over a set period of time.
Okay.
And instead of, me as a family doc, if I had you in the hospital, but I'm 30 minutes away, I can't get to you in the hospital. So that person, they are there all the time. Very similar to how emergency departments came to be as a department. So you have physicians who are at the emergency room, staffing the emergency room at that set period of time, so that anyone who's coming in, there's a team of doctors that they are there handling that. And so it allows you to focus more on that level of care. And so with the hospitalists, they are taking care of the primary things that are needed for someone who is hospitalized, with being that quarterback.
Okay.
Of kind of like me on the outpatient side, but they're the quarterback of the team when you're hospitalized in the hospital.
Okay.
And if you're having, your kidneys are failing, then the hospitalist brings in the kidney specialist.
Okay.
But the kidney specialist, if something were to go wrong with a different organ, is probably not going to address something that's going on with your heart. So, but the hospitalist will recognize that this is going on and be able to manage things as a whole. So you kind of have more, think of it as a quarterback of the team in the hospital setting.
Okay.
Yeah.
Do you feel that, this is just a question that just came to me, we have so many urgent cares now.
Mm-hmm.
And I notice in primary care, not direct primary care, when something happens, the comment is just go to go to the ER, go to the ER. So things are being treated at the ER for non-emergency things. Do you think that's the reason why we have so many more urgent cares to handle that?
Well, so one of it is an access issue. For one, a lot of people don't still have a primary care doctor.
Oh.
Okay. So if you don't have a primary care doctor, you know, if you got a sinus infection, who are you going to go to if you don't have a primary care doctor? Because most primary care doctor waits can be a month or two to get into.
Yeah.
So you have that situation. Then you have the situation where you do have a primary care doctor, but they don't have any appointments that day because they've already got 30, 35 people on the schedule. And did you call early enough? Or, you know, is there a slot that you can accommodate?
Right.
So you may not be able to, you know, to get in even with your primary care. So it allows for those things that don't need to go to the emergency room to be handled in a different way to help facilitate some of those visits that a primary care doctor may not be able to.
Okay. Interesting.
Yeah.
Well, I want to thank you, but now we're going to do, I love this round. It's called the quick fire round. So we're going to have a little bit of fun. So I have some questions to ask you. It's one or the other. Coffee or tea?
Tea.
Tea. Okay. I thought that would be right. Early bird or night owl?
Early bird.
Okay. Beach vacation or mountain retreat?
Beach all the way.
Really?
Yes.
Okay. Favorite comfort food after a long day?
I like to have dark chocolate and mixed nuts.
Oh.
And I'll give the brand Second Nature. I absolutely love it because it's easy for me just to come home, do that, and I have my sweet with my protein.
Okay.
And I absolutely love it.
And it's healthy too.
And it's healthy too.
So if you could master one skill instantly, what would it be?
Speaking Spanish.
Okay. Favorite quote or Bible verse that keeps you going?
Trust in the Lord with all thine heart and lean not into thy own understanding. In all thy ways acknowledge him and he will direct your paths.
I like that. I like that. What's one small daily habit that brings you joy?
The first thing I do every morning before I've gotten onto social media and all the other things is I do my daily scripture and my daily prayer. And that centers me. And when I get out of routine, if I don't do that day, my day just does not go right. So that is my first thing before I go and do anything, starting with that.
If you could have dinner with any historical figure, who would it be?
So it would be a difficult dinner, but Henrietta Lacks. Henrietta Lacks was a Black female that was tested. She had cervical cancer, and she's the reason why we have the Pap test and the technology of understanding cervical cancer now. But she went through a lot of testing painfully to be able to, for her to be able to see where we are in the advent of what we can do now to even prevent cervical cancer with a vaccine, to hearing her story of what it felt like for her to be on that side. I would love to be able to just sit and hear what her thoughts are about what she endured and what that means for us now.
Wow. How long ago would you say that was, roughly?
Oh, I wish I could tell you, but I don't remember the year.
Wow. Interesting. I want to go back and... What is one thing people might be surprised to learn about you?
Most people are surprised to know that I'm an introvert.
I knew that.
You knew that.
I knew that.
Most people assume because I do public speaking and I go and do events that I just kind of extrovert and I kind of float around. I have social anxiety.
Well, that I wouldn't have guessed at all.
I absolutely do. I have to do pep talks and talk to myself before I go to events about it's going to be good, and kind of walk myself through it. But yeah, most people are kind of shocked that is me, but it is.
Do you think most physicians are because they're very cerebral? To go through medical school, most of us can't do it. Do you think most are introverts in that way because of being so cerebral? And
No. I know some social butterflies.
Okay. Okay.
I know some social butterflies. So I can't say it's just that, but we generally will say for a lot of them, the ones who are significantly introverts and social butterflies go into pathology or
Okay.
radiology because they don't really deal with the people. So no, I think it's a good mixture of all just for the medical profession. But yeah.
So if you could give your younger self one piece of advice, what would it be?
Enjoy the moment now. I was, and we all do when we were kids. Most of my friends, oh, I can't wait till I'm 18. I can't wait till I'm 21. I can't wait till I'm, this or that. But really to be present at the time
Mm-hmm.
and um, learn the recipes of my aunts and my grandmother and my mom when they were trying to teach me to cook. I would say that, but I would say just be in the moment, be young because you're gonna be fine. I'm type A, and I wanted to. If you tell me this is what I got to do to become or do this, I'm going to do it. But I would say relax a little bit because it's going to happen even if it's not perfect.
Mm-hmm.
So be in the moment. Just relax. Your path is going to be great, but just be in the moment.
I like that. Thank you.
Yeah.
Thank you. So we have reached our conclusion, and I have a million things to say about you that really you have helped me in so many ways. My prescriptions are quick, they're fast. They don't always have to be. You have a right to have a life, but I don't know how you do it. They get done, and I see so many other people waiting for days and days and days. It just happens because the doctor's offices are so busy. Everybody has a task to do. Communication just kind of falls.
Mm-hmm.
And that's really what happens. It's not nobody's intentionally trying to not do
Mm-hmm.
things that are needed out there. But there has been such a return on investment, and that's my health. You have been there. You're an amazing doctor. I am so fortunate, and I believe the individuals that I know, anybody that that I've sent to you, they're just amazed because it's hard to find today. But it's been a pleasure to hear your story and to know that this started when you were 14 years old. From your roots in family medicine to pioneering a new model of care. Your commitment to patients, I am a recipient of that. Mental health, I am a recipient of that. And community wellness is inspiring. You're not one to just throw us on medications. You want to know what's going on, and that's really, really important. Thank you for showing us what it means to lead with faith, vision, and purpose. To all our listeners, remember, healthcare is personal, and it's okay to ask for better healthcare. Keep advocating, keep learning, and never underestimate the power of your voice. And Dr. Maxwell, thank you for joining us.
Thank you for having me.